Hi, EMT students. I'm here with my daughter, Maggie. She's going to be our patient today so that I can demonstrate some skills on her that you are going to try to replicate and record yourself replicating them correctly and send these videos back to me. So these are the things that you need for today. You need some gloves. If you don't have gloves, you can just always verbalize that you are using gloves. You need your book that you picked up from the school with all of your skill sheets inside. You need to have your bag with your supplies that you got from me from the school. And inside of there, we've got dressing. These little things are called dressings. This is a roller bandage. I have some thicker ones. It's exactly the same thing. It's just these ones are more bulky. You will need to have your triangle bandages that you find inside of your bag. And then you also are going to need to get a pen or a pencil or a stick of some kind. I think that's about it. So yeah, that's it. Okay, we're ready. So Maggie's going to have a laceration on her arm. I'm going to show you how to bandage different parts of the body, and we're going to start with something really simple. So we're going to say that Maggie has a laceration right here on her arm. She's bleeding profusely, and we need to get that bleeding to stop. So the very first thing that we do with our gloved hand is we apply direct pressure to that bleeding wound. And then what I need to do is I need to aseptically, I wonder if I can get this in the camera, aseptically take dressing, which means I take it from the top, I pinch it from the top, and I lift up so the bottom part of the dressing is not being touched. And I apply that directly to the wound, and I continue to apply direct pressure there. And then I'm going to take my roller gauze, and I place that over the top of this. And I'm going to start bandaging this. Roller gauze is bandage. So I'm going to roll that around there, kind of anchoring it on there, meaning I'm rolling it enough to where it's going to stay in place. And as I'm rolling that, we're going to say that this wound continues to bleed through the material here. So we never ever remove any dressing. I need to take more gauze or more dressing. So I'm aseptically picking that up aseptically from the top. I don't touch the bottom. The bottom part goes directly on top of here, and I continue to roll over this. Now, I can apply more pressure because it's pressure that stops the bleeding. And one of the ways that I can do that is I can take my roller gauze and I twist it. I don't know if you could see what I did there. I have my roller gauze, I'm unrolling that, and I take it and I just twist it. And then I put that twist directly over the injury, and I can do it again. I can do that as many times as I need to. Do you feel a little bit more pressure when I do that? Yeah. So I can keep doing that right over the wound, and that will help to stop the bleeding. And as soon as I run out of gauze, of roller gauze, I'm just going to tuck it in, and that's how I hold that in place. So Maggie, you want to hold your arm up? And look, this is the test. I'm going to take this thing and I kind of hold on to it and I tug on it a little bit, and it doesn't go anywhere. It stays in place. That tells me that it's actually pretty good. And one thing that I want, we want it to stay in place like that. One thing I want to do is I just want to check and make sure that she still has a pulse afterwards. I don't want to necessarily completely cut off circulation. I just want to stop the bleeding right here. If you still can't get it stopped, this is the point where you're going to apply a tourniquet. And I'm going to put a tourniquet on right now. You don't have the black or orange manufactured devices at home for you to use as a tourniquet, but what you do have is you have triangle bandages. So I want you to get out your triangle bandage, and when you open it up, it's the shape of an odd-shaped triangle, right? So what I'm going to do, I take the triangle bandage, and I'm just going to flip this around like that. Or I could do it a little bit differently. I could take a triangle bandage, and I can, it's hard to see on this video here, but I can fold it over and over again. So instead of it being rolled, it has a more flat surface. It's kind of a messy, it doesn't look really good, but I folded it instead of, you can see it better like that. I folded it. So I can use either or, the one that I flipped or the one that I folded. And I'm going to take this, and if I need to apply a tourniquet, I need to do that at least 2 inches above the wound but I would never do it over a joint. You never put a tourniquet over a joint. So I can go at least 2 inches above, or I can do what we call going high and tight, which means I would go all the way up here to her shoulder. And so I don't want to go over her joint. I'm actually just going to do it right here. So what I do is I take this, I'm just going to tie it like I'm starting to tie my shoe. Really simple. I didn't tie a knot or anything. I just tied it right there. And then I'm going to have Maggie help me. This is where you need to have your pen or your pencil. I'm going to place my pencil right there. You hold it right there, Maggie, just on the end. And then I take my triangle bandage and I tie it again. I only tied it once, okay? And then what I'm going to do with it, it's just being held still right there. The way that I turn it into a tourniquet is I start to twist it. You feel it getting tighter? Okay, so what I'm going to do, I'm twisting that until, even when Maggie says ow, which it's probably hurting now because I can see it pinching your skin, yeah. But I'm going to turn it until the bleeding stops. And that's how I know that I've put enough pressure up here that it stops blood flow to the lower part of the arm. So I'm not really going to tie it on that tight to Maggie because it's just a demonstration. I don't want to cause pain or injury to my daughter. And then what I'm going to do, once I get it twisted enough into place, I need to take these ends of my triangle bandage or my cravat, and I'm going to wrap it around. I don't know if you could see that very well in the video. I'm going to wrap it around one end. I'm holding it in place, and then I'm going to wrap it around the other end so that it stays there so it can't untwist. I'm going to go underneath her arm and then back up over the top, and I'm just going to tie it there. I can tie it underneath this if I wanted to, and I might do a double knot just to keep that in place. So that's how you create a tourniquet without a manufactured device, but you have some kind of material. It could be a torn up t-shirt, whatever it is that you have. Wow. We never have loud motorcycles until we're recording. Okay, is that bandage too tight on your arm?
No, it's fine.
Okay, so what I'm going to do next for Maggie is I'm going to say that now she has, so we just did like a long bone, something that's, that's probably the easiest thing to bandage. Now what we're going to do is I'm going to actually bandage a joint. So this is something that bends, right? So now it doesn't matter whether you're bandaging, whether the patient has an injury on the outside of the joint. This is for an elbow or for a knee, whether it's on the outside of the joint or the inside, okay? So we're gonna say it's the same, you're just gonna flip which side you put the dressing on and the pressure. I'm gonna aseptically pick up my dressing and I'll apply it to where the wound is, and I apply some pressure there, direct pressure. And I'm going to take my roller bandage and I'm going to start to roll this. The thing is though, I'm covering the inside section of the joint. So on the opposite side of her arm, turn your arm over, I'm going to not cover up the opposite side. So I'm going to leave her elbow uncovered. So as I roll this, or unroll it around here, I want to leave that elbow open and exposed, but I'm still covering and putting pressure on the wound on the opposite side. So I'm kind of doing a figure 8 here. And the reason I'm doing that is so when we're finished, Maggie can still bend her arm. Like, can you bend your arm right there? Oh, wow, look at that, it works. Okay, and I can do the same thing. If it's bleeding through, I can take more dressing, aseptically apply it to that. And I can take my roller gauze and I can twist it and put more pressure over that. And I'm just going to continue on until I'm out of gauze. And then I'm just going to tuck it in, just like I did with the other one. And then Maggie can still bend her arm. And I might even have the patient bend their elbow if that's where the injury is, or their knee, because it might even put some more pressure on that for me. And I could put her arm in a sling and swathe at that point if I wanted to do that. So, good? Okay, let's take this one off. Okay. One thing that I'm going to show you right now is how to roll these roller gauze bandages up again. Because you're going to have to do this over and over again with your bandages. So you're going to take your unrolled bandage, and this is exactly how you fix it. You take that and you just start to roll it up like this. And then what I do is I put it on my leg, and then I just manually roll it up. And once you've done it a few times, it goes really quickly. This one is still in really good shape, so I haven't had to flatten it out. But if I did, if it was all bunched up funny, then I would make sure that this is all flat. And if it's all snagged, then I kind of pull it a little bit and I unsnag it. And I make sure that it's rolled up really nice and neat, just so that I can use it over and over and over again. And we don't do this for real patients. This is only for practicing. If you have a real patient, you use it. When you take it off, you throw it away. Okay. Next, what do we need to do next? Let's take this one off too. Even though that's really pretty, that's like really pretty bandage. So we'll do this one too. This one's kind of a better one to show you on because I'm going to have to flatten this one out. But I've got it all unrolled, and I just start rolling it up there, put it on my leg, and here I've got to kind of flatten this one out a little bit more. Just make sure it stays straight, and this one's already kind of snagged a little bit. So I just have to carefully roll it back up. It is logic. This is so funny. Okay, then it's ready to go again. Okay, let's do your wrist. So this could be for an ankle or for a wrist, okay, another kind of joint. Or it could even be for a hand. So it doesn't matter whether we have an injury on the back of the hand or if the injury is on the palm side, or even if it's just right here at the wrist. We are going to aseptically pick up our dressing and apply that to a wound and apply direct pressure there. And then I'm going to take my, don't touch your face if you have been touching somebody's blood, or put your gloves on. I'm going to take my roller gauze and I'm going to anchor it around her wrist. So around the bottom part of her hand here. And I might do that a couple times. And then I'm going to, so that this doesn't move around at all, open up your hand kind of like that. And I'm going to go in between her thumb there. And this really holds it in place so that this bandaging can't go anywhere. And I can either choose to go only about this high on her fingers, or I can actually lift it up a little bit more. Either way is fine. But the thing is, you want to make sure that you leave all the fingertips out so that you can check for, capillary refill once you're finished with this. So I'm just going to unroll this until it's all used up. And if I have a really long roller gauze, then I might even just cut it, which you all have shears, but I would recommend not cutting it because you're going to need long ones to practice with. And there we go. So that's her wrist, all bandaged up really neatly. All right, next thing that we want to do is, what should we do next? Ooh, let's do your neck, okay? All right, you might need to stand up for this one.
Okay.
Okay, so go ahead and stand. All right, we're going to say that Maggie has an injury on her neck. So which side do you want the injury to be on?
Just this side.
Okay, so Maggie has an injury. She's bleeding on her neck. And we are not going to take a roller gauze and wrap it around her neck. We're not going to put pressure around the neck because, well, you're medical students, you should know why. That's going to hurt the patient. So instead, what we have to do with the neck, we're going to aseptically pick up our dressing and apply it to the wound and apply direct pressure. And I'm going to take my roller gauze, and Maggie, you need to lift your opposite arm up. So you're going to take your left arm, let go of your hair, hold your arm out, And I'm actually going to go down here underneath her arm, the opposite arm. Keep your arm out. Just hold it straight out. And I'm just going to keep rolling it, like unrolling it like this. And I keep going until I'm out of bandage. And then I ask the patient to drop their arm. So go ahead and put your arm down. Do you feel like it put pressure there on your neck?
Yeah.
Okay. So when she does that and she drops that arm, then it actually applies pressure right here, and it will help stop bleeding on her neck. Okay, thanks. You can sit down again. I think.
You think?
I think so. Yeah, you're good. Oh, let's do. All right, this time we're going to say that Maggie has either, she's got an ear injury, so one of her ears is injured. And so she's bleeding either externally from the ear. This is not bleeding that's coming internally from her ears. This is an external wound. If there is bleeding or fluid leaking from inside the ear, it's probably some kind of spinal injury, and it might be cerebral spinal fluid. We would never try to put anything inside the ear to stop the ear from bleeding. We will just allow that kind of bleeding or drainage to take place, and we leave it alone. But if it's actually the ear or anything around the head this way, what we can do is we can take dressing aseptically. We can cover that ear while at the same time kind of folding that dressing to the back side of the ear, kind of like grabbing onto it a little bit. And we don't want the ear lobe to stick to the neck, okay? So we want to put some kind of protective dressing between the ear and her neck. So Maggie, would you just hold that there for me for right now? Thanks. And even if her other ear is not damaged, I'm going to do the same thing for her other ear because I'm going to cover it up and I don't want her to be uncomfortable and I don't want the skin to be kind of sticking to the other skin. So put your other hand here and hold that in place. And then I'm going to take my roller gauze. We call this Curlex roller gauze, roller bandage. And I actually am going to have you stand up while still holding that in place. And then I want you to turn facing that way, other way.
What way?
That way, there you go. So what I want to show you is when I'm starting to do this roller gauze on Maggie, while I'm getting ready to anchor this, there's a specific thing that I want to show you while I'm anchoring. I'm not going to put this dressing clear up high like here, like I would a headband, like a 1980s exercise video headband. What I want to do is I want this to actually anchor the base of her skull. So in the video, I hope that you can see, oops, I'm trying not to lose control here of this. Hold that in place for me, Maggie. I'm going to lift up your hair. You're good. You're doing perfect. So I want this to go all the way down around the base of her skull. Can you turn around a little bit more? There you go. That's perfect. So see how far down I am? I'm just right at the base where her skull meets her spine. That's where I want this to anchor. You can turn or just stay right there. So I'm going to anchor it there. I can't see where to go. There you go. I'm going to roll around. Okay, you should be able to let go of that now. You can turn back towards the camera. So try not to cover their eyes. For Maggie, I've got her hair in her eyes, covered your eyebrows.
Way to go.
There you go. So, all right. So we're just thinking about our patient. We don't want to make this too tight on the patient, but we want it tight enough that it's not just going to slip off. And the way to make sure that it doesn't slip off is that you anchor it at the base of the skull there. Just try not to cover up their eyes, just like I said, just like I did to Maggie. I'm so sorry. There you go. Anyway, you can play with that and fix it and fold it under a little bit for them to make it better. When you run out of this, what do? You just tuck it in, just like everything else. And that's how we hold it in place. Okay, so do you want to turn all the way around and they can see How awesome that looks on your head.
Wow.
Yeah. Okay, we're going to start a new look. Kind of like a mental patient, but okay. All right, get ready to catch those dressings that are behind your ears, okay? That was great, Maggie. All right. And then we're going to do the top of your head, okay? So that was for an injury that is either the ears or anywhere around where that roller gauze was covering. Okay, you can have a seat again, honey. Okay, move forward a little bit here. All right, next we're going to do the top of the head. And actually, I'm going to move up a little further. There you go. So we're going to say that she's actually got some kind of wound right on the top of her head. And so I'm going to aseptically pick up my dressing and apply it to the top of her head. And this part's very important. You have to do it pretty much exactly right or it's not going to work. So I'm going to take my roller gauze and I'm going to make sure that I measure it starting at her shoulder. It needs to reach all the way to her shoulder, maybe a tiny bit longer than that even. I'm going to drape it down over the top of her head. Do you remember this one?
No.
And I'm going to meet her other shoulder. And then I'm just going to keep draping this back and forth. So we're kind of making like this George Washington wig or dog ears, whatever you want to call it. And I just keep unrolling it back and forth. This is going to be really fun with long hair. We'll see if I can do it without pulling your hair, okay? Now, the second part of this is similar to what we just barely did. So I'm going to try not to cover your eyes, and I'm going to anchor this around the base of the skull, just like I did the last time. Okay, I got to look at your face to make sure. You look so cute. This is a good look for you. Thanks. So I'm going all the way around her head. Hey, do you want to just shift a little bit so they can see the back of your head too? Back of your head is ridiculous. All right. So, perfect. Okay, you can face forward again. So when I get down to the end of this, I'm just going to tuck it in just like I have every other time. Now, here's the fun part, okay? Your eyes are probably going to get covered. I'm going to try not to pull. No, I'm not done. We haven't put any pressure on the top of the head yet, so I'm not done. I'm just preparing this masterpiece. So I'm going to grab onto, not your hair. Please don't pull your patient's hair if you can help it. I'm going to grab onto these dog ears, not the hair. And then what I do is I grab onto that and I pull it down. Sorry, Max. Pull it down. I'll fix your eyes in just a minute. And then I'm going to take these and I'm going to tuck it in. You're a lot more fun to make videos with than Sam.
That's good.
Okay, did you guys see how I did that? I'm just lifting this up, trying not to get any hair. And then I just tuck it in. Side zero. Harder for me. I don't know why. There we go. Okay, and then let me see you. And I'm going to pull the front of it up a little bit. There we go. There we go. And then did you feel when I pulled that down, did you feel that it put some pressure on the top of your head? So you can do that. Now, Maggie, now you need to stand up and turn around so they can see how that looks. Again. Okay, awesome. Okay, cool. So there's the top of the head. Yeah, I love this one. It's so good. Okay, we're a quarter way through this video. Maybe more than that. With this one too, I forgot to tell you, but you guys are gonna do what I say, not what I do, right? You could put some kind of dressing behind the ears on that one too, so that it's more comfortable for your patient. Hey, do you want to help me roll that up? I've been doing the other ones.
Was I supposed to be paying attention?
Yeah. Okay, so just
Okay.
straighten it out and then start to fold it over at the very top and just keep it flat. And then you can put it against your leg or your belly, whatever you want, and just start to roll it up. And then when you get to a part that's snagged or not flat, just flatten it out. Most exciting part, but you guys are going to be rolling and unrolling and rolling and unrolling over and over again anyway, so it's okay. Okay, we're getting through it. Let's see, what else do we want to do? Let's do your jaw, okay? So you can have a seat. All right, if we have a patient that has a jaw injury, there are a couple of different things that you can do. Basically, wherever it is on the jaw, we're going to aseptically apply dressing and some pressure. You hold that there. And you can always ask as long as your patient is alert and oriented enough to follow commands, then you ask them to do something and they can do it, then have them help you. That's fine. You can do this thing that you see in the movies. You just got to be careful that you're not actually occluding their airway, which is one reason why I actually don't like this. I don't like to do this to my patients because if you're doing it very tight, do you like that over your throat? No, it's really uncomfortable for patients. So it's an option, but I don't like to do that. So if it is a jaw injury, yeah, grab that. Oh, put on your necklace, sorry.
Oh, sorry.
Remove your patient's jewelry. It'll get caught up. If they have a jaw injury, the thing that I prefer to do is I aseptically take some dressing, and that's a really bad example because I just touched it. Take the dressing, and then you're going to apply it to the jaw, and I would tape it down. Just get some medical tape, and then you're just going to tape it onto the jaw just to put a little bit of pressure there. And that's what I prefer to do. So that's how you're going to take care of a jaw. Now, if your patient has a cheek injury, let's say that they have any kind of cheek injury, you will also aseptically, every time it's aseptic technique, going to take this dressing, and you can have your patient open their mouth. We're going to say this is an injury that actually goes through the cheek, so I'm not really going to do this. But they're going to open your mouth, and then I would actually take this and I would reach inside of the mouth and I would apply pressure that way, and I can even ask the patient to help hold that pressure there if I need to do that, okay? But the patient needs to be alert and oriented enough that they can follow commands. You need to make sure that you're not occluding the airway, that they can still breathe okay, and that they can swallow and everything. But that's one thing that you can do for a jaw or the cheek. Okay, we're going to do an impaled object. So we're going to take this pencil, and let me unwrap your wrist first. We'll wrap this one up later. Okay, so what did I say we're going to do? Impaled object. Okay, so we're going to take an object, and this is any impaled object. We're going to say that it happens right here on Maggie's arm. She got stabbed, okay, right in the arm. So you're going to hold that right there. And what we want to do, if your patient has anything impaled in them, we will never remove that object, except there are exceptions to rules. The exceptions are if that object is impaled in your patient and it's actually, let's say that it's through the cheek, It's somewhere through the jaw. It's somewhere around here, and it's occluding your patient's airway, and they cannot breathe, or you cannot breathe for them because that object is in the way. You may remove the object. You may remove the object. The other time that you are allowed to remove an impaled object is if it's through the chest and you need to do CPR on your patient. Then you can remove the object. Those are the only two times that you are allowed to take an object out. Even if your patient is impaled on a fence post or something that's stuck into the ground, you have to call in the right people with equipment, and that might be firefighters. You might be getting firefighters on the scene. You might need farmers. You might need welders. You might need people to come and cut the object that your patient is impaled with so that you can transport them. But we never, unless it's in the chest and you need to do CPR, or if it's around the airway and you need to have access to their airway because your patient cannot breathe, you're going to leave whatever other object is impaled in the patient there. Leave it in place. This is a very simple example. You remove the object.
I know. I'm so
Did you
sorry.
not hear what I just said?
I was zoned out.
Okay.
That was
All right. So this object is impaled, and just hold your arm up there for me. You can even rest it on the table if you want. And what we need to do for an object like this is I'm going to get bulky dressings. And for me, what that looks like, and for you for practicing, you might need to get washcloths or a dish towel or something that you can roll up or fold up. It could even be your triangle bandages, okay? You get triangle bandages, something bulky, a bulky dressing of some kind. I love Curlex or these big fluffy roller gauze, and you're going to put them on either side. And this is basically to stabilize it. And so I'm going to hold the roller gauze right there. And also it makes it kind of big so everybody can see, okay, there's something big going on here with the patient. And Maggie, you can let go of the pencil, but I want you to hold onto the roller gauze like that. Then what I'm going to do, I'm going to take another roller gauze and I'm just going to secure it. I'm going to wrap it just like my other things that I've been doing. So hopefully you can see what I'm doing. I'm going to start anchoring this around this bulky dressing, and I'm going to start doing a figure eight around this object. So I went on the back side of it, and now I'm going to go across the front. And I'm just going to go back and forth that way, making sure that I'm covering as much of this as I possibly can. And I might want to go, if it's too big, I might want to go more than one time on the same side. But eventually, I need to go back to the other side and do this whole figure eight thing. And we want to make sure that we're not jostling this around, that we're not disturbing this, because it could be right up next to an artery that is severed, or a vein, or nerves. And we don't want this to move around because we don't want it to cause more damage on the inside of the patient. So depending on what the object is, where anatomically it's at, what's located near that position or that area of the body, you want to be really careful, and you might have other people helping to stabilize this and to hold this still for you. But that's all I'm going to do. The principle is very simple. As soon as I run out of my roller gauze, I'm going to tuck it in to hold it in place. And at this point, if she has this object in here, I'm not just going to stop there. I'm going to splint her arm now, because I want everything to hold still. And I might splint her arm, and then I might attach it to her body using a sling and swathe, which I'm going to show you next. But I want everything to be immobilized or to be held still. And I've shared other videos with you of other people doing splinting techniques that are really good. They're using the SAM splint, which you all have a SAM splint. So you can watch those videos and practice that, record those too, and send those back to me. Okay, we can take this off now. The only people to remove other impaled objects would be the nurses and physicians once they're in the ER and they've got a team of people there ready to take care of whatever bleeding might be going on. And for all of these things, you may want to be thinking about calling for advanced life support. to help you, because they're probably going to be needing IVs and fluid, possibly blood. So be thinking about that. Hey, Max, will you turn sideways? And I'm just going to show if you had an injury on your back. Thank you. Okay, so if she's got an injury on her back, it's kind of similar to if we had a neck injury and I placed a dressing there and then I kind of went around her body this way. We're going to do the same kind of thing. I'm going to take the dressing aseptically and apply it to whichever part of the back she's got that injury on. Apply some pressure. I'm going to take my roller gauze. And depending on where it is, I can grab it. Oh, it just fell off. We're going to pretend that didn't happen because I actually have an invisible EMT partner that has their hand right there helping me. So I can do this similar to the neck. Okay, I can wrap that way. Or if it's lower down, then I can have that dressing there. Oh, you might need to help me. Pass that to me. You're my EMT partner, but lift up your arm. It's going to go under this arm.
Where is it at?
Right there.
Oh.
You could go around this way, so just lift your arms up a little bit. And when you're working on a female, depending on how high up this is, you can either go over the top of the breast tissue or underneath, depending on what you need to do for your patient. Just remember to be careful with everyone. Make sure that they're comfortable, that you've got enough help, and that you're not causing any physical discomfort to your patient. So that's one way to do that. Okay. All right, we can take that off. Okay, cool. All right, we're going to create a sling and swathe now. So what I want you to do is take your triangle bandages. You're going to unroll them, unfold them so that they're the triangle. And there's two really long sides and then there's a short side. I'm going to take that short side, okay, this one, and I'm just going to tie a really simple knot like this. And I only just tied it once, okay? And so now my triangle bandage looks like this, okay? So that short end has a little knot in it. So everybody do that. Pause your video if you need to so you can get your triangle bandage like that. And I need a second triangle bandage, okay? So this part right here with the knot in it, this is my sling. And we're going to have, I want you to stand up for this, I think it'll be easier. So this knotted part right here is basically going to be like a little catch for the patient's elbow. So you're going to just, usually when you're taking care of a person and you need to put their arm in a sling, a lot of times they'll already be holding their arm in the position that's best for their body. And most of the time it'll be like this. And this is typically about the position that you want your patient's arm to be in. So I'm going to take this little knotted section here and I'm going to put it right at the elbow, on the outside of the elbow. And then lift your arm up just a little bit. And I want my sling, one side of it is going to go right behind her arm, but still over the front of her chest. It doesn't go behind her, it goes to the front of her chest. The second part of it just goes over the top of the arm. So this knot is on the outside part of her elbow, okay? And one of these is going to go around the left side, one is going to go around the right side. It doesn't matter to me which one you do, okay? I think I'm going to do it this way.
Going up like that?
I'm going to fix it.
Okay.
So the back of the neck, if you have someone with long hair, don't tie their hair up. But you can tie it like this. I tie just like that so I can pull it and let it go really easily. Turn to the front. Now I'm going to fix this because it wasn't supposed to do that. There we go. Oh, it's a little too tight. So we're going to fix it. And I want it to be, so start to drop your arm just a little bit. Right about there. So as soon as the arm gets into that position, you can see Maggie's arm is in. that's where I'm going to tie it. Make sure this is on the outside of the elbow. This part right here, just totally relax your hand. See how her wrist is just dropping like that? We don't want it to do that. We want the wrist to stay in a good position like this. And we also want the hand to stay in what we call the position of function, which is when you're relaxing and you have dropped your arms. Look at my hand so you can kind of see this one really good. My hand is kind of in this curved position like that. We want everyone's hands to stay in this position of function. The way that we do that is we give them something to hold on to, okay? Whether that means that if we're splinting the arm, we're going to do the same thing. We're going to put their hand in a position of function. So that might be the SAM splint is molded into that position, or we can put a Curlex or a roller gauze into their hand to hold on to. So I'm actually going to give that to Maggie. So I'm just going to tell her just hold on to that. And she just holds that, and then I make sure that I've made a cradle for her wrist and her hand to rest in. But I'm leaving the tips of her fingers out so that I can check capillary refill and make sure that I can see the color, that I can test cap refill very quickly, that I can still reach in there and find her radial pulse to make sure that she still has good circulation, good PMS in that arm. So are you totally relaxed, your arm?
Yeah.
Okay, good. So that's the sling, and now we have to do the swathe. And the swathe, we're going to take our triangle bandage, our second one, and hold it like that again. And just what I do, you can either take the time and fold it neatly, or you can just flip it around like this, which is really fast. I think it works just as good. And I'm going to now swathe it, meaning I'm tying her arm down. So I want you to lift your left arm up, Maggie. I'm going to come around this way, and I basically just tie the second one in place. And now for my patient, what that does, people think that the sling is enough, but when you are practicing this, I want you to notice and talk to the patient that you're practicing on. If you only have the sling on their arm, they still feel like they have to control their arm and they're having to work to kind of hold it up. When you put this swathe on, it reminds the patient not to move it, and they actually can relax a lot better. And so just totally relax your arm, and they shouldn't have to do any work because the purpose of this is to do the work for them. So they're not having to lift this up, but it's still in a really good position. Okay, so that's a sling and a swathe. And I think we may have covered everything. The things that I want you to remember from this, though, are that we always want to check PMS after we have bandaged, after we've splinted. Make sure that you still have good pulse motor and sensory. And if you're splinting, you also want to check before you start to splint. And whenever a patient is bleeding, because these skills right here are mainly for controlling bleeding, we need to make sure that that bleeding is controlled. And you can always add more dressing, but we never take dressing off. We always just add to it, okay? And remember that you can take your roller gauze, and as you are unrolling that on the patient, as you go over the wound, you can twist it and put that twisted section right over the wound, and that will apply more pressure to your patient. Practice that on your non-infected humanoids. And ask them, do you feel like that's more pressure? And you're going to have to practice this probably a few times to make sure that as you tug on those dressings and the bandaging that you put on, that they're not too loose and that they're not too tight. So practice that. And then I want you to remember too that once you have treated for bleeding and you've gotten the bleeding to stop, or maybe it hasn't stopped, and then you have to make your triangle bandage or cravat tourniquet for your patient, you need to check and make sure that the bleeding is really controlled. And then your patient might be showing signs and symptoms of hypoperfusion, which is shock. Your patient could be in shock. They probably will be. A lot of people, if they start to lose blood, they're showing signs and symptoms of shock. And shock, just in case you don't remember, is when your patient, at least hypovolemic shock or low volume shock, low blood volume shock, is when your patient has lost enough blood that they don't have enough red blood cells to carry the oxygen that all of their organs need. Their brain doesn't have enough oxygen, their heart, their lungs, their liver, their kidneys, even their skin. everything just doesn't have enough oxygen. And so we're going to treat that patient for shock. And the ways that we do that are we give our patient high flow oxygen. So whatever red blood cells they do still have in their body, we're kind of hyper loading them. We're trying to make sure that they've got plenty of oxygen to carry around. So we give them high flow oxygen, which would be probably 12 to 15 liters of oxygen with a non-rebreather mask. We're going to lay them down. We're going to get their head about the same level as their heart, so their body doesn't have to work as hard to get that oxygen pumped up to their brain. This is important. This section from the top of your head here to your torso, super important. So make sure you lay them down, and then we're going to keep them at the right temperature. So we'll probably cover them with a blanket. Most of the time, your patient is pale, cool, and clammy. They're pale because they don't have enough oxygen, and they're cold because their body is not getting enough oxygen. Their body's trying to compensate, and they're clammy because everything is just trying to overwork, and we're trying to fix all of those things. So lay them down, give them high flow O2, and cover them with a blanket. So you've treated for a shock. And I think that's it. Yeah. Okay. So make sure that you practice the skills, record them, and send your recordings back to me, and I'll talk to you all next week. Thanks, Maggie. You're a good patient.